great demand, short supplies. KPIX5's Susie Steimle on shelter workers who are hoping to move up on the vaccine priority list.
For Jaleesa Patino, it's impossible to practice physical distancing at work.
So most of the time I do have to physically see people. Most of the people don't have phones, so we wouldn't be able to coordinate a Zoom meeting.
She's a residential coordinator at Home First, a homelessness service provider and shelter in San Jose. She's already had COVID-19 once and is worried she could get it again.
Thankfully, I didn't get it that bad, but it's a little bit more scary now working here, knowing that I can get it again.
Jaleesa's boss petitioned the county asking that she and other frontline workers be moved up on the priority list for COVID-19 vaccinations. The county agreed.
Hopefully, I'll be able to get vaccinated within the next few weeks.
Glide Memorial Church in San Francisco is doing the same thing for its frontline workers who serve the homeless.
That if we can provide the vaccine to these folks that are providing these safety net services, it creates a safety and security for all residents of San Francisco.
State guidelines put shelter workers in Phase 1B Tier 2. Right now, we're in Phase 1A, which has 3 tiers. First come healthcare workers and long-term care residents, then people over 65, educators, and agriculture workers. The state has also started Phase 1B Tier 1. Shelter workers are scheduled to be up next, but many still haven't heard a timeline for when it will be their turn.
No one's talked to us. No one said anything to us. We have no idea when that would happen.
We caught Wesley Dewan on his delivery route for the East Oakland Collective. He also spends time in encampments, connecting people to services.
You have no idea who's been where. So you take your precautions. You stay 6 feet apart. You put your mask on, and you do what you can with that.
They're basically risking their lives every day going to work.
Jennifer Friedenbach is the executive director of the Coalition on Homelessness. She points out that more than half of the homeless population is over age 50, and on the street, you age about 20 years faster. So in her eyes, these shelters are essentially nursing homes.
They're a lot older than their calendar age because of the living outdoors and what that does to the human body.
The shelter workers face inequities of their own. Jaleesa, for example, lives in a multi-generational home with her parents and grandparents.
It's a lot of Black and brown community members. A lot of people, because of systemic racism, have compromised health already. Also, because of systemic racism and lack of housing, they're doubled up and in crowded housing conditions.
There's also a push to vaccinate the unhoused population more quickly. Right now, they're in the same tier as the shelter workers.
They need it as soon as everyone else does. Otherwise, what are we really doing here?
Susie, if homeless people were moved up in priority, how would the state go about tracking everyone down to make sure that they receive those 2 doses?
Well, that's one reason why these shelter workers say they need to be prioritized. They say they know where most homeless people are staying, but that's also an argument against it. There is some concern that it might be hard to find people, and they don't want to waste any of these precious vaccines that so many people are waiting for.
Sure. All right, Susie, thank you.